You are a dentist experienced with dental implants, providing your patients with excellent work, but over the years, more and more patients have been coming to your practice with problems related to their implants. They feel maybe discomfort, notice a bad taste, experience some bleeding, or even pain in the area around their implant. So does this sound somehow familiar? Hey there, I'm Dr. Tobias Steinherr, and I'm a specialist for biological dentistry and ceramic implants. And today I want to chat about the top reason why our patients face issues with their dental implants. If we can do something about it, and little spoiler alert, the answer is no and yes, so make sure you stay until the end of this video to discover, at least in my opinion, the only way how to face and encounter the real problem. If you've been placing dental implants for more than, let's say, 5 years, I'm sure you've encountered similar issues in your practice. So what went wrong? Did you make any mistakes? I mean, implants are supposed to be like a long-term solution, potentially lasting for decades or even a lifetime. At least that's how they're marketed, as a permanent solution. I mean, we know from hip joints, for example, that they have to be replaced after 10 to 15 years. But I think no dental implant company has told you ever in one of their courses, hey, the great thing about our system is that after 15 years at the latest, you will have to renew the implant so you can do it again and open a whole new sales cycle, boosting your revenue to a new level. Isn't that great? So, but joking aside, even if you did everything perfectly and you made no mistakes, I don't want to be the party pooper here, but you simply can't defy the laws of physics and biochemistry. Because titanium as a metal, and I know I said it several times before, but that's because it's such a crucial point to understand. So titanium faces challenges in an environment filled with moisture, microorganisms, and possibly even different metals from other restorations. And thus it undergoes various forms of corrosion, biocorrosion, tribal corrosion, and galvanic corrosion, leading to a foreign body response, loss of bone attachment, and secondary infection, often caused then by anaerobic microorganisms. And these simply are the symptoms that we know as peri-implantitis, and they are as inevitable as the number of affected patients is growing every single day. Professor Thomas Albrechtsson, one of the pioneers in titanium implantology, has addressed these issues and provided a critical as well as analytical perspective on titanium and peri-implantitis in numerous studies, such as this one. According to many experts and researchers, and I'm sure as an experienced dentist you will agree, peri-implantitis is the dominant problem when we talk about dental implants and their long-term effects, not just on our patients' health, but also on our revenue and reputation as dentists. So the $1 million question is, what should you do now? Try one of the many approaches to treat peri-implantitis? Well, at least you have to do something, because otherwise it will only get worse. But I don't want to burst your bubble here. Just don't set your expectations too high, because if we look at the literature, on one hand, studies on peri-implantitis and its treatments have increased massively in the recent years. Yet on the other hand, there is still no satisfying and proven treatment option. You can sometimes stop it, sometimes you can slow it down, but there is no sufficient and satisfactory treatment that truly solves this problem in a predictable way or avoids it in the first place. I just picked one of many studies for you to take a closer look. So besides all different generic risk factors, they also state that, interestingly, time of function is a factor itself. So what this basically says is, just wait long enough and you will get into trouble. But what do they state about the different approaches to treat peri-implantitis? Mechanical debridement alone may fail, but also surface decontamination, the definitive clinical benefit, is not yet proven, and laser treatment may result in a short-term decrease. And the current evidence indicates that regenerative approaches to treat peri-implant defects are unproven. predictable. So like I said earlier, unfortunately, there is nothing like a predictable treatment option to rely on and to tackle the threat of peri-implantitis successfully. So you can, and of course you have to try your best to get the infection under control, but there is no secret sauce to solve the problem once and for all. The problem of peri-implantitis is even getting bigger each year as millions of titanium implants are placed annually, all facing the same statistical issue. After 10 years, up to 50% of those implants will encounter problems with peri-implant mucositis and peri-implantitis, just as the studies on the unsuccessful treatment concepts seem to grow exponentially. Peri-implantitis does too and will continue to do so. Okay, but I still didn't give you the answer what to do, because as you just saw, there is no final answer for how to treat the peri-implantitis problem. But what if the thing with peri-implantitis wasn't what we thought it was all the time? Would you be open to looking at it from a different perspective? Because if we consider peri-implantitis to be primarily an infection or bacteria-driven phenomenon, and yet no antibacterial treatment consistently leads to a predictable and long-term stable outcome, could it be that our assumption about the triggering event is inaccurate? Remember Albertson's thesis that peri-implantitis is primarily a foreign body reaction to titanium, with the infection occurring as a consequence. So the only way to completely prevent peri-implantitis might be, and you maybe don't like to hear this, but to avoid using titanium in the first place. And what might initially sound strange or even unthinkable could actually be a blessing in disguise. Think about it. By using zirconia implants instead, you can prevent peri-implantitis from the start because it simply doesn't occur. With zirconia as an oxide ceramic and due to its material properties, there is no corrosion and therefore no foreign body reaction to particles or free electrons released over time. I talk about this in more detail in the video course where I compare titanium and zirconia in greater detail. I think I will tell you at the end of this video how and where to watch the video for free, because you won't find it here on YouTube. But the absence of peri-implantitis is not the only advantage. There are many other pros once you become familiar with how to use them correctly. They promote, for example, higher quality soft tissue with a better blood flow and less plaque adhesion. The use and the protocols are a bit different, as the material properties and the handling differ from titanium, but once you've mastered the transition, I promise you will literally enter a new world of dental implantology. So if you are interested in more details, as I said, I recorded a whole 30-minute lecture about the differences between zirconia and titanium, covering the different advantages with studies and case examples. And you can get access to this course for free. I put a link in the show notes below this video for those of you who want to dive deeper into this whole topic. Having placed and restored thousands of titanium implants and ceramic implants myself, I switched to zirconia implants around about 6 years ago after spending a decade deeply involved into titanium implantology. So I don't tell you all of this being like blind in one eye. I was a huge titanium fan until I learned more about ceramic implants. Because later, I was fortunate to be part of the dental team at the Swiss Bauerhealth Clinic, one of the leading clinics in biological dentistry and ceramic implants, where I was trained by great people like Dr. Ulrich Volz, one of the, well, I would guess worldwide most experienced dentists globally when it comes to zirconia implants. But you don't have to move to Switzerland with your whole family like I did some years ago to get the most comprehensive education on this topic. I've set up a program where I can get you from I don't have any clue about ceramic implants to placing and actually restoring your first ceramic implant in less than 180 days. With this one-on-one mentoring program, I can support you in all the steps necessary to successfully transition into a bright ceramic future without peri-implantitis. To check out your fast track to ceramic implants, simply hop on a personal Zoom call and let's discuss the strategies to make you a true ceramic mastermind. So if this resonates with you, click on the link in the description box below. to schedule your call or just meet again in another video. So make sure you subscribe and stay in touch to get more infos about zirconia implants. And most and foremost, always remember, if we can do better, we should do better.